Thank you all. I want to begin by asking you, how many of you have ever been asked this question before? Raise your hand. And keep those hands raised if this question has ever given you any type of stress or anxiety. Yeah, that's a lot of people. And we're almost all grown adults, right? And so when I think about it, it's crazy that we ask 17-year-olds this question, and we ask them to make very important life decisions based on the answers. No, and yet this is what we do every single year across the US in our high schools. And I know this because I used to be a high school counselor, and I worked at one of the lowest income areas in Houston. Most of my students were on free reduced price lunch. They'd be the first in their family to go to college. And the reality is a lot of them didn't get into four-year schools. And so when I would ask them this question, they'd look at me like you just did, with that kind of like, ooh, I don't know, I'm a little bit anxious face. What I'm here to tell you is that those faces reflect a really, really big underlying problem. And that's because for students that I worked with, like Perla, they've been told for years that to go to college would mean that they would realize success. And so when Perla didn't get into any of her four-year schools, she didn't know what to do. And so she enrolled into her community college thinking that she would transfer. And yet a month later, she told me that she was going to drop out because she didn't really see how that equation fit. Or I think about students like Luis, who was really clear with me and said, I don't know what I want to do after high school. I just need some time. And it's been 2 years since Luis graduated from high school, and he's still working at Taco Bell down the street of our high school. The sad reality is that for students like Perla and Luis, there are opportunities. All around the US, we're experiencing this middle skill job gap. There's so many jobs for community college graduates, and employers are dying for talent from local communities. And yet the students I worked with didn't know that these existed. So there's a divide here, and this is what Bridger tries to solve. Bridger connects students to community college by exposing them to high-growth careers in well-paid professions. We do this through a 12-month program. So starting in spring semester of their senior year, this is when a lot of students don't know what they want to do, and they're getting those rejection letters from four-year colleges. We condense the best aspects of an internship into a 15-minute career test drive. When you and I buy a car, we don't just buy it blindly. We take it for a test drive. We allow students to do that for careers. So in this picture, my students are doing a medical laboratory technician test drive, and they're analyzing fake urine for diseases like UTIs or diabetes. And it's funny, some of my students are super gung-ho about this, and they get incredibly excited. And some of them think this is disgusting. But that's okay, because if they think it's disgusting now, they shouldn't go to school for it. We take that excitement, or sometimes that disgust, and we then talk about what's the path to get to this career. This is crucial. Students can have a goal, but if they don't have the steps to get there, that means nothing. The pathway mapping process does this for students so they know when they graduate what to do. Finally, during the most vulnerable months of college success, we pair our students with a near-peer advisor. The near-peer advisor is a current college student who has experience with community college systems, and they provide support through text, which is quite honestly where students want to receive support. Again, we focus on these months because these are the most vulnerable months, and we see a lot of dropout at these stages. So by providing the career clarity, the timely support, we fuel students' college and career success. And it's a self-fulfilling cycle because our mentors are hopefully former students that come back and mentor the younger ones. Excited to share our results. We worked with over 200 students to date. And this is a picture we found on Instagram just last week. He worked with us in January. Oh, my screen disappeared. He worked with us in January, and he came in not knowing what he wanted to do, like many of our students. And so we put him through the Farm Tech Career Test Drive, and he was floored and super excited. As you can see, he went out and purchased a Farm Tech exam prep book, even though he knows he doesn't have to take this exam for another 2 years. And his counselor is telling us that he's super excited about going to community college, and we'll be working with him on enrollment steps this summer. It's not just him. 95% of our students said that they would recommend this experience to a friend. And this past summer, our students enrolled into community college at twice the rate of a local group. We know our work is far from done, and as we continue to grow, we'll be tracking success metrics such as community college graduation and then eventual placement into jobs. We're doing this through a sustainable nonprofit model. Our career test drives are partly funded by employers who provide in-kind donations. All the career test drives that we've done so far have been supported by these types of donations. We also rely heavily on volunteers who help facilitate these experiences, and we recruit college interns who are subsidized by their college and by the city of Houston. In terms of funding, as a nonprofit, we do expect a portion of our funds to come from philanthropy. We have a soft commitment for the 2018-2019 school year from a local foundation in Houston, but are also exploring earned revenue opportunities, and we have 3 identified early adopters. The first are community colleges. Community colleges benefit by increasing their enrollment and receiving a dedicated group of students who are focused on their goals. We have a paid contract commitment starting in June for a small pilot with the largest community college system in Houston. We're also speaking with other nonprofit organizations. They don't necessarily have the funds to give us directly, but they're excited about exploring joint grant opportunities because we're one of the only organizations that bridge that gap between college prep and workforce development. And finally, since a lot of our work happens at high schools, our counselors and our principals have told us to tap into their field trip funding and CTE, their career and technical education funding, in the future. But to do all of that, we desperately need your help. We've been bootstrapping, and that's worked really well for us for now, but in order to really accelerate our growth, we're excited to kick off stage 2 at Bridgeyear. Right now, we're limited because we can only go to high schools that have empty classrooms or empty cafeteria spaces for us to set up. And we need to spend that time to set up and clean up our career test drives. Stage 2 would take our career test drives and put them on mobile buses. And we'll adopt a bookmobile or food truck style model so that we no longer have to rely on schools for that space. This will allow us to accelerate our growth, reach more students and more schools over the next 2 years. The prize money from Thorne will allow us to purchase and outfit our very first vehicle and use it as a proof of concept to gain future revenue. We know what a tremendous impact we can make in this space just by connecting students to high growth careers and giving them the supports to get the degrees to get those careers. Our students as community college graduates would earn an average increase of $400,000 over their lifetime, and they're 1.5 times less likely to be in poverty or unemployed. Bridgeyear is all about connecting students to opportunities that they didn't know about. We think that when we help students answer that question of what they want to be when they grow up, but we also provide the experience and supports to turn those dreams into reality, and we're excited to involve you in that process. Thank you.
Good afternoon. My name is Arsema. These are my teammates, Luke and Marcus, and we are Mosaic. Okay. So the refugee crisis isn't new. With countless hundreds of people being forcefully displaced from their homes every day, the current aid situation is just not cutting it. That's where we come in. We provide refugees a means from which to thrive. So currently, the refugee cycle consists of 4 stages. The first, home or pre-migration. The second, the exodus from their town or country. The third, temporary resettlement. And the fourth, permanent resettlement. And we're about to show you how we revolutionize these last 2 and most impactful stages of the refugee cycle. So currently, 1 in 2 Syrian refugees have higher than a high school education. And 86% of Somalian and Sudanese refugees have some sort of formal training. This wasted human potential is a problem, and we are the solution.
As evidenced by the aforementioned statistics, it is clear that refugees exist in a state of limbo that is not at all conducive to socioeconomic advancement or cognitive stimulation. That is why Mosaic has aligned our business model to incorporate a number of resources, including vocational training programs and a microloan exchange platform, all directed towards refugee socioeconomic empowerment.
So the primary facet of Mosaic is the vocational training program. By giving refugees an opportunity to a wide range of income-generating skills, we're allowing them to take the power into their own hands. And the reason we have this in part of our model is due to the fact that 89% of refugees continue on with their learned skill even after resettlement, showing the impact this opportunity has in their lives. This is Rhea, a Rwandan refugee who fled her home country during the genocide. She watched the school that she taught in burn down and then relocated to the Kakuma refugee camp in northern Kenya. There she found herself idle, with no one to teach to and no place to teach. But without funds, there was nothing for her to do. So she applied for a loan, received a loan, and built an iteration of that school at the refugee camp.
A microloan of the kind, such that Rhea received, can enable the cultivation of the entrepreneurial spirit, which we believe is evident in the ambitions of tens of thousands of refugees just like Rhea. Mosaic's microloan platform is crowdsourced, bridging lenders who are genuinely eager to help refugees better their condition with recipients who could stand to benefit the most from access to new capital.
And they're able to access this capital through our e-commerce platform. Here, refugees can sell the items that they've made, like the ones that we've shown here today and that I'm wearing on myself, to anybody around the world, giving them access to a previously inaccessible marketplace. And this all hedges on the idea of mobile banking. This new technology that's been introduced to Kenya is M-Pesa, that functions under the umbrella of Safaricom and Vodafone, two of the largest network providers in Africa. Now, refugees are able to send and receive loans and realize their revenue. And having a smartphone or Wi-Fi connectability is no longer a barrier for doing so.
Through vocational training and microloan lending, Mosaic connects the dots between refugees and the skills and capital that they need to realize the prospects of occupational opportunities as well as entrepreneurial ambition.
So let's zoom out and see how Mosaic fits. First, we have our vocational training program. Now, refugees are able to learn an income-generating skill. But without a way to utilize this knowledge, it seems futile. That's why we have our loan exchange platform. Refugees now have access to a funding source in order to materialize that knowledge and a certification for the knowledge that they've gained. But we've now crowded the local marketplace. That's why we need our e-commerce platform. By having refugees able to sell online, they're having access to a global marketplace, therefore diffusing the tension between refugee and host citizen by decreasing the amount of competition and by starting a symbiotic relationship between the host citizen and the entire host country.
So Mosaic's technical and vocational training program includes modules on how to begin a new business with the support of the microloan through our platform. We also hope to advise and guide refugees with services that can provide them with legitimate opportunities, steering them away from the informal economy, while also encouraging them to take advantage of the global market. We aim to provide refugees, which we understand to be a population conditioned by absolute need, by providing them the means by which they can be highly industrious. To be a refugee is to have no certain future, extremely limited opportunities for personal growth, and a nearly complete dependence on foreign aid relief. We hope that with Mosaic, we are able to restore the rights and dignity of tens of thousands of refugees by nurturing their socioeconomic empowerment.
Aside from connecting refugees to external marketplaces, we also help them build a credit history by reporting their loan payments to credit bureaus. Our platform also enables us to connect refugee ventures to refugees in need of jobs. We improve the lives of many by improving the life of one. So there is a lot of synergy between our business model and the refugee population. As you can see, refugees will be able to source raw materials from the host country, in turn stimulating the local economy. We aim to focus on Kenya because there is a very high concentration of refugees in the area. starting off with the Kakuma refugee camp. Our implementation methodology generally entails us honing in on countries that have refugee camps by leveraging our relationship with the UNHCR. This will allow us to get a foot through the door, and then we can later on expand our service to helping those residing within urban slums as well. Mosaic will look a little different everywhere we go. We have an adaptive business model that is meant to ensure unique success across a wide variety of contexts. With regards to the $25,000 in funding, we believe this to be crucial to our endeavors, as it will allow us to validate our market and create a proof of concept. Once we've proven that our model is capable of generating revenue and also growing at the same time while impacting a large number of refugees, we'll be able to leverage this to gain further investment later down the line. This is a brief overview of our 5-year profit and loss projections. As you can see, we realize a positive margin after our 5th year of operation.
Here's how we've put together the pieces of our mosaic thus far. We're ready to roll out our pilot program in Kenya and deploy our first vocational training curriculum. We're also currently in negotiations with Safaricom and Vodafone to concurrently deploy our loan exchange platform. This summer, we plan to travel to the Kakuma refugee camp in Kenya to gather data and do a reasonable resource feasibility assessment. Aside from being awarded the Hull Prize at Yale, Mosaic has also received the official endorsement of not only the Turkana County government in Kenya, but also that of the United Nations High Commissioner for Refugees.
With all the talk of rollout plan, logistics, and profit and losses, we cannot forget the faces of the millions of people we're about to impact. As the daughter of a refugee, I understand the value of what we're trying to provide. And after visiting 5 refugee camps, all of us collectively, and speaking to countless of refugees, we have interacted with the people whose lives are about to change. There's a Swahili proverb that says, "From crawling, a child learns to stand," and we, Mosaic, provide the ground underneath their feet. But we'd be remiss not to mention the mentors and advisors that have helped us in the Mosaic journey, game changers in the space of social impact entrepreneurship and the refugee crisis. Who are we? We are the founders of Mosaic, 3 students who are simply unimpressed by the status quo. Thank you.
Hi, my name is Trang. This is Victor. We're both juniors and co-founders of Penta, a nonprofit that repurposes used prosthetics in developing countries. So I'm originally from Ho Chi Minh City, Vietnam, and my grandmother has a limb disability, which is where I first witnessed firsthand how difficult it was to access prosthetic care. So today in Vietnam, there are 4 million amputees, and the main causes is the Vietnam War, landmines, and traffic accidents. 95% of these amputees don't have access to these life-changing prosthetic limbs. This is because the cost of prosthetic ranges from $2,000 to $10,000, and this is way beyond their financial capabilities.
What if we told you a solution to this global health challenge lies in garages and storage spaces across this country? On average, an amputee replaces their prosthetic limb 10 to 15 times throughout their lifetime, and many of these equipments are very high quality and reusable. However, they can't resell or repurpose these equipments in the US because of regulatory and liability issues. So because of that, more than 200,000 prosthetic devices go to waste every year in this country. So at Penta, what we've done is created a collection system that we think will become the default choice for repurposing used prosthetic devices and eliminating this waste. So we created 2 different models to get prosthetic limbs from individual amputees and from prosthetic clinics. We then go through a robust quality control test and recustomization through our strong partnerships with local clinics and hospitals in Vietnam. And finally, these prosthetic devices are fitted to our individual patients, each with their recustomized needs.
For individual amputees, we have a simple donation platform. So the amputee with a used prosthetic to donate logs onto the website, uploads photos of the used prosthetics, and within 24 hours, we check the quality and send back a free shipping label. From there on, they can track the status of the used prosthetic. We also provide a personal story of who the used prosthetic has been fitted to. Last summer, Victor and I were in Vietnam where we met Tan, a 17-year-old boy who lost his leg at age 13 in a traffic accident. He wasn't able to go to school for 4 years, and after being fitted with a prosthetic, he was able to regain mobility and go back to school. This was one of the most moving experiences for us, and we wanted to replicate these for the donors.
For our partners' clinic chains, we have developed a streamlined system to collect used prosthetics and help clean out their inventory. So we've set up Penta boxes in their storage spaces where individual prostheses can drop off their spare parts and also let their patients know about our services whenever they come in for a new prosthetic device. Every 2 or 3 months, we either pick up these boxes or have the boxes shipped to our central location. Right now, we're targeting 3 clinic chains. Hanger Clinic, which has around 700 clinics across this country, and 2 regional clinics, NOPCO and NEOPS, which has around 60 clinics in the New England area. So this is what we've done with our collection model over the past 3 months. We've collected from 17 individual amputees, 27 clinics. We've also connected with 22 amputee support groups, and in total have collected more than 400 prosthetic components. We've also set up boxes in 3 clinics in all the targeted clinic chains through this past month.
So after the used prosthetic is collected, it goes through a process of quality control and recustomization, all done through a partnership with the largest orthopedic hospital in Vietnam. So for the quality control process, there's 3 stages: the site test, which we do in the volunteer platform, and then the strength test and balance test. So how does recustomization work? So for all components below the knee, such as the knee joint, the pylons, and the foot, these are all standardized components that can be 100% reused for any amputee. The socket component is the customizable part, which we make a new socket for every patient. And for the old socket, we remelt it and recycle the plastics.
So our whole system is legitimized through a contract, which is signed by the 3 parties: Penta, the hospital in Vietnam, and the individual patient. So this legitimizes the whole process, makes it transparent, and also ensures payment up front. On average, a patient pays $200 in total, which is a fee far less than the $2,000 to $10,000 currently on the market. Of this $200, $130 goes towards the hospital for the contracted fitting fee, $25 goes towards covering our shipping cost, and the $45 covers the remaining overhead cost.
This model has been validated through a trial run. We fitted 31 people with prosthetics. We've interviewed over 100 amputees and collected a database of over 1,000 amputees. We've also formed strong partnerships with the largest orthopedic hospital in Vietnam, 2 private clinics, which we work directly with 18 prosthesis and technicians. We also have partnered with a local disability group that provides rehabilitation resources for our amputees after they've been fitted. So these are our 2017 deliverables. I will be in Vietnam full-time in the summer to handle the fitting of the 200 used prosthetics that we have already collected and to refine the interview and inventory process.
I will be in the US focusing on expanding our collection model. In May, we'll push out our digital platform for individual donors and continue strengthening our partnerships with the 3 clinic chains that we've just mentioned. By the end of July, we hope to have 1,000 individual amputees as our donors and 50 clinic partners. And by the end of 2017, we hope to have 2,000 used prosthetic components and devices. So through the support of the Thorne Prize and the YEI Fellowship, we hope to use this money to really go towards our summer pilot run of 200 prosthetics and our phase 1 expansion of 2,000 prosthetics by the end of this year. So this money will go towards getting a storage space for our expansion, logistics and shipping costs, and also for our fitting fee.
So we see this model as very scalable. Right now in developing countries, there are 40 million amputees without access to prosthetic limbs. So for the next step, we would look to countries like Laos, Cambodia, Thailand, which are close to us with similar demographics. So for our team, we have 6 core members. I'm in charge of the Vietnam side and handling logistics of inventory, working with the hospital for recustomization and quality control. Victor is in charge of the youth prosthetic program, and so we have 2 other team members, Moses and Henry, who works with him for partnerships and clinics. We also have 2 grad students. One is an industrial design grad student, the other is a biomedical engineer, and they help us with the technology aspect of it. And so for us, we believe that through a simple and transparent system, we can divert medical waste and transform lives. Thank you for listening.
Go ahead and get started. I'd like to introduce our team who is here today. So right now, dialed in, we have Adebayo Alonge, who is the CEO and founder of RxAll, and he'll be joining us during Q&A. We have our CTO, Ankur Kapadia, who will also be joining us during Q&A. And we also are very, very honored to have Dr. Daniel Edereti, who is also a Yale student and has Nigerian market contacts. He used to be a pharmacist in Africa, and just in case we experience technical difficulties with Adebayo, he'll be able to jump right in during Q&A. I myself, my name is Amy Cao. I'm a second-year MBA student, and I'm the CMO of RxAll. And here with me presenting today, very honored to have my colleagues, Anna Huang, who is our Director of Technology, as well as Wei Lu, who is the brain behind all of the science that you'll get to hear about, and he is our Chief Science Officer. So thank you so much. We are ready to get started. All right, so the story of RxAll begins with the personal experience of our CEO and co-founder, Adebayo Alonge, who, from Nigeria, almost died from using counterfeit medication when he was barely a teen. Now, the drugs that he was taking was supposed to cure his malaria, but as his symptoms worsened each and every day, he was eventually rushed to the emergency room, where fortunately, he was afforded another opportunity at life through intensive care. Dr. Daniel Edereti, whom we are so fortunate to have with us here today, had a fever when he was 2 years old. Not knowing what to do, his parents took him to the nearest federal hospital, and not knowingly, he was administered in that hospital counterfeit medication, consequently leading him to lose all sensory feeling in his left leg. Now, Adebayo and Daniel, both of them were afforded another opportunity at life because this was their miracle. However, around the world, not all patients are as fortunate. In Africa alone, over 100,000 Africans die from using counterfeit medication each and every year, and this number is continuously growing as counterfeit drug distributors penetrate the rural African markets. Dr. Daniel Edereti can tell you, he used to be a pharmacist in Nigeria, that there is so much administration work in order to do the authentication of pharmaceuticals across the supply chain. Now, this problem has been tackled from a variety of angles, and many solutions have been brought to the table, such as the use of trusted barcode scanning and these scratch-based phone authentication systems. But as you can imagine, these systems are easily duplicated and have already been defeated by counterfeiters. So the only true way and solution is to truly regulate the supply chain from end to end, from distributor to pharmacy, and that's where RxAll comes in. RxAll is a 2-pronged solution, the procurement platform as well as the authentication system. Now, the procurement platform comes to our customers in the form of a user-friendly Amazon-like website where pharmacists can order guaranteed authentic medication at the comforts of their homes and deliver to them at a fraction of their price. The second part of our solution, the authentication platform, utilizes spectrometry. So you can imagine now going to a pharmacy and bringing your drugs and scanning your drugs, and within minutes, or less than a minute, be able to receive a notification on your cell phone telling you whether or not that drug is real or fake. That data is then fed into our authentication system, which utilizes deep learning, machine learning algorithms, and artificial intelligence in order to generate actionable insights to the large playing companies who would be very, very interested in using the data, such as large pharma companies, Pfizer and Merck, hospital retail distributors, as well as regulators. We started our company in Africa because that is where counterfeit medication is truly a problem. In the open drug markets alone, over $600 million worth of drugs are procured on an annual basis. We've started and piloted in Nigeria and Kenya because that's where we have local knowledge, and that's also where we have a large pharmaceutical presence. Now, why are we so excited about our idea at this particular point in time? Because right now, more than ever, there are Africans using internet on a daily basis, and each of them had access to a smartphone. And we truly believe that this increase in technology adoption will truly be a key enabler to our technology solution. And to talk more about our solution, I'm now going to turn it over to our Director of Technology, Anna.
So this is what our current digital marketplace platform looks right now. We require pharmacies, manufacturers, and distributors to upload their pharmacy's license so we can verify both sides of the transaction. And since launching our platform, rxing.com, in October 2016, we are very proud to announce that we have served over 100 pharmacies and 200 patients. For our second part of our solution, the authentication platform, this platform is based on a machine learning matching algorithm. And this is a really important solution to have just because this will allow consumers to truly verify or not the drugs that they have are real. And now we actually have filed a patent in China, and I'm currently working with the OCR to file a patent in the USA. And now I can hand it back to our scientist, Wei, who's the brilliant mind behind this authentication platform, and he can explain how it actually works.
Thank you, Anna. Now I'll provide a brief introduction to the scientific foundation of our solution. So our authentication platform is based on a technology called spectroscopy. It turns out beside the visible range that our naked eye can see, there are so many other wavelengths radiation in the nature, which specifically the infrared radiation we can use to take picture of the molecules, the vibration, the motion, the structure. We can record the fingerprint, molecular fingerprint as spectrum. That's the foundation how we can tell which one is counterfeit, which one is authentic. So spectroscopy has been widely used in the industrial setting here in the US, for example, the agriculture, product quality control, pharmaceutical quality control, and even wire fermentation quality control. The problem about using it, trying to apply it to African market is the cost of the spectrometer is really high. So like StellarNet and Ocean Optic, the major supplier in the US, they serve those kind of near IR spectrometer cost at 20K level. By utilizing the dynamic light processing technology from Texas Instruments, instead of using a linear in gallium arsenide array, we can use a single unit in gallium arsenide detector to cut the cost from 20K to a few hundred, which make it possible to use it in African market. So this is a flowchart how our authentication platform works. Now Amy will help me to do a live demo to show how it works.
Okay, so right now we have pills. This is actually anti-malarial pills. It's the most prevalent, most counterfeited drug in Africa. And as a patient now, you just purchased these pills. So how do you know whether or not these pills are fake or real? So we're going to have Jay, would you do the honor of helping us test A5? And Wei is going to walk us through the demo of what you will see on your cell phone. So how that works is you take the pill.
Hold up what you've got there so we
Sure. It's a scanner, essentially. Okay, and we're going to have now, Jay, you can go ahead and place the pill right here on the scanner. So
A5?
Yes, A5.
Okay.
It's
now
all
we do
ready
the scan.
Yep.
You can see it's
yep.
working.
This is what you'll see on your cell phone.
Okay, now that's the data from this specific drug. And I can now send the data to my server that run the machine learning algorithm. It will come back the response in counterfeit.
Okay, so you don't want to eat this one. All right, so now we'll have Rob do us the honor of testing now A11.
Okay.
Okay.
Just in a sec.
We'll leave it here for you.
Okay, now
A11.
11. Let's do the scan right now. Okay, now let's do this. Wait for it, because the server is on my old desktop. You can understand that.
Here.
It's authentic.
It's authentic. Yay.
That shows it's working. Thank you.
Wonderful. Thank you so much. All right, so now that we've learned about the technology behind, or the science behind the technology of our platform, we'd like to now take a look at the market opportunity. So the spectrometry market for drug authentication is $800 million, and it's growing on an annual basis. From a competitive landscape, we are the only company in Africa that is utilizing this unique technology to authenticate drugs, and we are bringing it to African pharmacies at an affordable price point. We intend to earn revenue from both the procurement and authentication platform. We intend to earn commissions as well as shipping fees to pharmacies. We will also, from an authentication platform, charge a subscription fee as well as license fee for the large paying customers to utilize our AI platform. Here is our 5-year financial projections. We just finished our Q1 results. We are still in year 0 just as a procurement platform, and year 1 onwards we're going to phase in our technology and start to really keep the financial momentum going, and we intend to be profitable in the next 5 years. From a social perspective, since our launch in October, so 3 months until Q1, we have served over 250 patients. We have delivered over 300 medicines to our customers, and we're operational in 5 cities. We are incredibly blessed to have amazing partnership and support from Yale University and large pharma companies, most recently our Merck Accelerator program, which we just launched in Kenya. We also have ongoing collaborations with the Nigerian Ministry of Health, and with the help of the Thorne Prize, we intend to expand our impact and our market reach. We hope to open up offices in Nairobi, Kenya, as well as Lagos, Nigeria, and continue to grow our commercial development platform. This is our team. We are all fiercely committed to alleviating the problem of counterfeit medication. We are all proud Yaleys, and so we want to bring it back to Yale's original model, which is light and truth. And we truly believe that our solution uses light to determine the truth and provide it to those who need it the most. So with that, that is our story, and we thank you so much for listening. Thank you so much.